Hi there, my name is Ian Conroy and I go to Louisiana State University. In this video, I will be talking about osteoporosis. The big question is, what even is osteoporosis? It is defined as a disease in which the density and quality of bones are reduced. The word osteoporosis literally means porous bone. The inside of bones contains spongy tissue which are constantly being broken down and replaced. In a person with osteoporosis, this spongy tissue will be much more porous and less dense. A person reaches peak bone mass where their bone density is at its highest point in the lifespan, which is usually in the early 20s. For the remainder of a person's life, bone density is expected to decline, increasing the chances of developing osteoporosis and resulting in a broken bone. A person who has developed osteopenia would have lower bone mass than a healthy person of the same age, but does not have severe enough bone loss to be classified as osteoporosis. There are a variety of things that can affect the amount of bone loss which will occur. Some of these factors cannot be changed, but many lifestyle factors can be changed to optimize a person's health. Risk factors that cannot be changed include a person's biological sex, age, their body size, their ethnicity, and their family history of developing osteoporosis. Risk of osteoporosis is much higher in women than it is in men. There is a common misconception, however, that this is a women's disease. Around the world, 1 in 3 women and 1 in 5 men older than 50 years old are at risk of an osteoporotic fracture. The most common places for these osteoporotic fractures are in the hips, the spine, and the wrists. For body size as a risk factor for osteoporosis, smaller, thinner-boned people are at a higher risk. Asian and Caucasian individuals are at a higher risk than other ethnic groups, and people with a family history of developing osteoporosis are also at a risk due to heredity. While all of the previously mentioned factors are innate and cannot be changed, there are quite a few alterable aspects of a person's life which can affect bone health. Exercising regularly and eating a balanced diet with enough calcium and vitamin D are the best ways to make sure bones stay strong. Some of the best calcium sources are dairy products like cheese, milk, and yogurt, fish like sardines and salmon, beans and lentils, almonds, dark leafy greens, and fortified foods including soy products like soy milk and tofu. Vitamin D is necessary for absorption of calcium. Foods high in vitamin D include fatty fish like tuna, mackerel, and salmon, dairy products like cheese and milk. Vitamin D is necessary for absorption of calcium. Foods high in vitamin D include fatty fish like tuna, mackerel, and salmon, dairy products like cheese and milk, egg yolks, and many other fortified foods. Vitamin D can actually be made by a person's body with direct sunlight to the skin. To get enough vitamin D from the sunlight, however, does not take very long, so getting a sunburn is not necessary. Bone mass acquired during childhood is an important determinant of the risk of osteoporotic fracture later in life. The higher the peak bone mass, the lower the risk of osteoporosis, so kids should be active and have balanced diets. There is a direct relationship between smoking and decreased bone density. Smoking can even inhibit healing after a break. Excessive alcohol consumption is another behavior that can negatively affect bone health. A bone density test can be done with a non-invasive DEXA scan, which uses X-rays. People can sometimes be concerned about radiation, but this test exposes patients to less radiation than a round-trip flight and is proven to be safe. The National Osteoporosis Foundation recommends that people have a bone density test if they are a woman 65 years or older or a man 70 years or older, if they break a bone after the age of 50, if they are a woman of menopausal age with risk factors, if they are a postmenopausal woman under the age of 65 with risk factors, and if they are a man 50 to 69 years old with risk factors. The results of the DEXA come in T-scores, which compare bone density to people of the same age. This is how doctors diagnose people with osteopenia or osteoporosis. When someone is diagnosed, what are the options for treatment? While osteoporosis isn't completely reversible, it is manageable. Diet and exercise are recommended, but doctors can sometimes prescribe a variety of medications. For postmenopausal women, estrogen replacement therapy, or also called hormone replacement therapy, can be an effective way of managing age-related bone density loss. While bone density is the most important factor in managing osteoporosis, risk management must also be addressed. For someone with a documented risk of fracture, such as an elderly woman with low bone density, safety of her environment should be assessed. A few changes which can greatly improve this type of person's safety include wearing proper shoes, using a cane or walker if needed, and avoiding slippery steps or sidewalks. As adults age, they can prevent falling at home, which can result in an injury by adding grab bars in the bathtubs and showers, getting shower and bath mats with grip, adjusting furniture to hold on to something when walking, and many other retrofits designed to improve safety. Breaking a bone can greatly decrease the quality and length of life for an older adult. Ensuring optimal health through the entire lifespan increases the likelihood for living a long and happy life. It is important to know your risk and make adjustments to suit your needs. For more information on this topic, you can check out a few links down below.